In today's medical moment, cuts to the state budget are resulting in drastic reductions in prescription reimbursement for independent pharmacies. New rules rolled out just over a week ago. Already 10 Valley pharmacies have been forced to close their doors. Nario, Rene, Cantu, and Muniz, registered pharmacists, join us live today. Victoria has more.
Thanks so much, Mary. And we are talking with Mr. Cantu and Dr. Muniz, who are here to tell us more about what's going on with this. Now, gentlemen, you guys have a lot of experience with this. You've been in this business for quite some time. Tell us why mom and pop shops are the ones that are being affected the most by these cuts.
Well, I would say probably it's all pharmacies are being affected. It just depends on the percentage of Medicaid business that you do. And being that we're here along the border and we have a higher percentage of the population that are Medicaid recipients, it tends to affect our ability to serve the customers. It's crippling and in some cases shutting pharmacies down, and their ability to provide services to the entire community are going to be affected. So if you fill a prescription for your mom or your father or your children or yourself, you could experience longer wait times if more pharmacies are forced to close. So it's a crisis that needs to be addressed, and we need a resolution and some relief.
And you know, one of the major points with this that the statewide lawmakers are saying is that the taxpayers are actually the ones who are really going to be saving money on this. But it's not saving money for these pharmacies. Tell us more about that.
Go ahead, Nadia. Okay. Well, the situation is the monies are actually being siphoned from local economies and being shifted to insurance companies that are out of state. It's going to be costing, the closure will cost jobs, local jobs, and will prevent people from being able to get the services that they need. These are life-sustaining services. Deliveries are no longer being done by local pharmacies because the government's, the state's not paying for them anymore. These insurance companies that manage the programs aren't paying for them. So homebound patients or patients with have transportation issues are unable to get their prescriptions. It's more difficult for them, and that could make them, you know, have a more difficult time in healing or becoming healthy.
And more specifically, Dr. Muniz, you were telling us last hour about some of the statistics here in the Valley, how many people rely on Medicaid. Tell us more about that.
Sure. 1 in 8, 1 in 7 people are on Medicaid statewide. And again, this program is affecting everybody in the state of Texas. It's not just the Rio Grande Valley. The reason why we're hearing more about it in the Valley is because 1 in 3 recipients, 1 in 4 recipients here in the Valley are on Medicaid. So it affects us a whole lot more. So because of these cuts, us independent pharmacies are having to find alternative ways to provide services at a lower cost. You know, either cutting employees or actually reducing deliveries. You know, as we've mentioned, deliveries will be reduced totally. And before, so many patients have been relying on our delivery services, which was provided for free. People who are homebound, people who are being taken care of in nursing homes, they don't have access to a pharmacy. They can't just walk into a pharmacy and get these medications. So that's a huge concern.
And you know, as a little girl, I remember walking into my local pharmacy and grabbing a lollipop off the shelf and just being so happy to be there. But later on in the show, you guys are going to be back because you are not just the first in your family, you're one of many generations that's actually been in the pharmacy business. So you're going to tell us more about your personal experience with what's going on.
We'd love to do that.
We're going to have you back in just a little bit, so stick around for that. Mary, back to you.